and they're just set up in the community. Whoever wants to organize a walk-in clinic, the advantage of the walk-in clinic is you don't need an appointment. So if you have a cold, if you have a sore ear, if you've cut yourself and you don't want to go and wait in the emergency department, you can go into a walk-in clinic. They're also useful for patients who haven't found a family doctor yet, or the family doctor is too far away, or the family doctor can't see them for a day or two. You can go to a walk-in clinic, but they will not, they're basically for semi-emergent problems. They won't do checkups, they won't do preventative medicine, and you have no idea who you're going to see there. It could be a different doctor each time.
ウォークインクリニックは救急外来とは違いますから、これは家庭医の先生がやってる、時間外も含めてですけども、誰でも来られるようなそういうクリニックということですね。で、家庭医と専門医って何が違うかって、日本ではそういうシステムがないからあれなんだけど、今だいぶ出てきたけども、トレーニングがね、医学部を卒業してからのトレーニングが若干違うんで、家庭医の人は広くかかりつけのお医者さんとしての技量を磨くためのトレーニングをするし、専門医はその部分はあんまりトレーニングしないけども、本当にその狭い一分野だけトレーニングすると、そういう違いがあるんでね、でそれがこういう仕組みの根本にあるんです。で、これがウォークインクリニックのいいとこ悪いところも書いてあるんですけども、これは皆さん多分ご存知だろうと思います。
So they do have advantages, and they do run longer hours usually. Their hours are usually later than a family doctor's office. But there's no appointment, so you have to wait for first come, first serve. And the medical care there is really meant to be sort of temporary, semi-emergent problems. Like I said, you will not get checkups, you will not get any sort of preventative treatment. And I guess the other problem is you never know who you're getting.
だからなんていうのかな、仮もうどうしようもない時にちょっと行くってエマージェンシーではないんだけども、でしかも健康診断もやらないし、they don't do vaccination.
Generally, they won't do preventative care.
一般的には予防接種もしませんから、本当になんていうんですかね、ごく簡単な、準救急のようなことでちょっと見てもらうっていうような格好になるんだろうと思います。で、誰に見てもらえるかわからないし、そういう意味では不安な要素もあるかもしれない。予約がありませんから待ってないみたいな間違いです。
And there's a website where if you want to find out if there's a walk-in clinic in your area, they have a list there of all the programs that run walk-in clinics.
はい。
小さいお子さんでもオープンクリニックで見ていただけます。
All ages.
Yeah.
でもさっき言った通り誰が見てくれるかわかんないからね。だからありふれた問題なら、小さいお子さんの患者さんでも十分見てもらえると思いますよ。
So there are such a thing as private. You might hear about it or read about private clinics. There are 3 of them here that I've listed: Regal, Cleveland Clinic, Healthcare 365. These are clinics where they would give you primary care like a family doctor, but at a price. In general, these are clinics that are used by businesses to give primary care. Generally not necessary for the average person, because you should be able to get all these services for free through OHIP. These are clinics that charge a fee for looking after you. In general, they're being used by private businesses for executive physicals, or as a perk for their executives. For most people, not necessary. They probably don't give you much different than you get from a family doctor, but you're free to look them up and find out if there's something there that you're interested in, but they're generally quite expensive.
人間ドックの類だとかね、それからホテルみたいなところで見てくれるとか、なんていうんですかね、会社ベイストリートにあるような会社で、その役員に待遇の一部として会員権を渡してっていうような、そんな感じのプライベートクリニックで、行きたいお金払うのが 嫌じゃなければ言っても構わないんですけど、すごく高く取られると思います。でやってることは、ファミリードクターですから同じで変わらないけども、そういうなんていうんですかね。
And in general, although they're operating in a gray area, right? Because, like we said, for the Health Act, everybody's supposed to have equal access to medical care. They are not allowed to say that they can get you in any quicker to see a specialist or get surgery done any sooner because it's equal care. So that's why they sort of have a very limited role.
だから憲法違反っちゃ憲法違反だからね、本当はみんな同じ医療を受けられることになってるんですから、ただこういうものも存在すると。飛行機でビジネスクラスとエコノミーで着く時間が到着時間が変わらないっていうのと同じようなもんかなと思うんだけども、興味ある方はこういうふうに調べることもできます。There are other services listed here.
Yeah. Okay. So. There are lots of other services, most of which are covered. So, for example, MedVisit, which is a house call service. So, for patients who are either bedridden or can't leave the house, or their problem is so serious, but not serious enough to take an ambulance to the hospital, they don't know whether it's a big enough problem, you can call this number, and they will have doctors come and do house calls, again, totally covered by OHIP.
往診のサービスですね。So even the first timer.
Even somebody that says they have a cold, if they want, they can call this service. I can't guarantee that they'll get there within half an hour or an hour, but if they want somebody to come and do a house call, this is a service that will provide it.
そうだから往診のサービスはここでやってくれるので、There's only one.
MedVisit is, there used to be a lot more. I think this is the only one that's left
In Ontario.
in Ontario.
昔は他にもあったんだけども、今これしか残ってないそうですけど、そういうサービスもある。
Telehealth is a health information service by phone where you can call and there's a nurse available 24 hours a day. You can tell them the problem. They will sort of do an assessment about whether they think it's something serious, not serious, tell you whether it's something worthwhile going to the emergency department now, whether you should make an appointment with your family doctor tomorrow, or not important at all. So it's useful for information. There's also, I think, a mental health helpline for patients who are having sort of mental health crises. There are, I think I had something, there may be on the next slide, there are other things offered by Public Health in Toronto, like classes for new parents and access to midwives and things like that. But
No, that's all.
Okay.
電話医療相談で日本語の通訳もあるんで、使われた方いらっしゃいます？待ち時間がどのくらいとか僕ちょっと情報を持ってないので分かんないんですけど、そういうサービスもあるということですね。あと子どもさんがいらっしゃる方は、なんかお母さんの薬を大量に子どもが間違って飲んだとかっていうのはポイズンセンターっていうのが僕の病院、僕の顧問のところにあるんだけども、そこも24時間休みなく、電話相談を受け付けてるんで、もちろん救急病院行かれるのももちろん大事ですから、そういうところに相談されるのもいいということです。ファミリードクターに関して質問が次にいくつか出てます。So, do family doctors have specialized domain?
So most family doctors are generalists. They can handle most problems. Some family doctors have limited their practice or they specialize in certain things. Some family doctors do sports medicine, for example. Some family doctors only do counseling and psychotherapy. And some family doctors have different interests. Some actually are doing only cosmetics. But most family doctors are generalists and should be able to handle most problems.
トレーニング自体がその全般的なトレーニングなんで、ほとんどのファミリードクターは何でもできることになってますけども、中にはその特定の分野に、焦点を当ててプラクティスされている方もいる。Is there any way to
find out.
find out.
Not usually. So not, but you should expect, if you're seeing a family doctor, you should expect that they should be able to handle, they're trained to be generalists. They should be able to handle anything that comes their way. And if there's a problem that they can't deal with, they will refer you on to somebody who can deal with it.
まあ、公に調べる方法はないんだけども、まあ、スポーツメディシンクリニックって書いてあれば分かりますよね。で、他にもまあ手立てはあるかもしれないけども、一応まあ原則としてはファミリードクターっていうのは何でも見れるっていうのがファミリードクターの根本ですから。So to make an appointment with a family doctor, is there any way to
Make it earlier.
right?
So, if you have a family doctor and you have a medical problem, call the family doctor's office. If it's something of an urgent nature, you should communicate that to the receptionist, and they can either move up your appointment or get you to call the family doctor to call you back to discuss the problem. Again, you always have the option of going to the emergency department or a walk-in clinic if either the doctor's not there that day or they don't have any room to see you. But that should be something that the family doctor's office should be able to discuss, sort of assessing the situation and deciding how early the appointment is. For example, in my office, if somebody is just saying, okay, I just need a checkup, they have no particular problem, that appointment is farther away than if somebody has a problem, let's say a respiratory infection or an illness or abdominal pain, we see them much quicker.
まあだから症状によってね、その家庭医の先生の受付に連絡したときに健康診断って言ったら、そんなにすぐはしてもらえないでしょうね、混んでればとね。まあ、症状によっては、まあ、その組み合わせによっていろいろ考える疾患があるんで、早くした方がいいと思われれば、医師の方で判断すれば早くなるだろうし、まあ、全てが医学的な判断になるんで、何かその非医学的な理由で早くしてもらいたいというときはどうするかっていう質問であるとしたら、ちょっとそれは何とも答えようがないんで、まあちょっとこのセミナーにはあんまりそぐわないあれかもしれないです。そういうこのことで何か質問ありませんか？はい。
私のファミリードクターのオフィスではウォークインにあんまり行ってほしくないようなことが書いてあって、なんか情報を管理できないから、ちゃんとアポイントメントすべての情報をこっちで把握できるようにしなさいっていうようなことが書いてあるんですけど、もうウォークインの方がだいぶ近かったりするので、本当にしんどい時はウォークインに行きたいと思うんですけど、そうは問題ない。
そういう、まあそれはその先生がどう考えるかによると思うんで、確かに患者さんによってはね、ウォークインクリニックで処方してもらったものをね、言わないとかね。で、かかりつけのお医者さんから処方されてる薬をウォークインクリニックの医者が知らないでなんか違う薬を出してってもうすごく混乱してくることがあるんでね、そういうことが嫌なのかなと思うんですけど、まあ事情によってはね、ウォークインクリニックに行ったって仕方ない事情がある場合もあるだろうから、ただそれはもう本当にその先生の考え方だろうと思うんですけどね。まあでも川先生のお話聞いてたら多分お分かりになったと思うけど、あんまりだからウォークインクリニックに頼るような非常措置ですよね、ほとんどね。どっちかというと。どうですか、やっぱり。じゃあ次は。So, if patient has some concern that his or her own language skills, can she or he make an appointment again with the family doctor for the same problem?
Yeah, so there's no problem. I mean, if there's a concern that the information wasn't communicated well to the doctor, there's no rule that says you can't book another appointment with the family doctor. They won't say, well, you know, I don't care. So especially if you think that in the meeting it wasn't communicated what the problems, for sure you could do that. By the way, what I didn't mention is in that College of Physicians and Surgeons website, if you look for family doctors, they should be able to tell you which languages they speak. So if that's, you can search by it.
Yeah, it does.
Yeah.
まあだからこれは問題ない、まあ、患者さんとお医者さんの関係でね、同じ症状であってもそのコミュニケーションの不安があってということであれば、何もそれは予約もう一回取って構わない。あとカレッジCPSO のサイトでもしお医者さんを探すときにはどの言語が達者かっていうのが書いてありますから、それよろしいですか？ So what if the patients want second opinion?
So we're talking about two different types of second opinions. So first of all, if a family doctor sent you to a specialist does an assessment, gives you an opinion, and you're saying, well, I don't really agree with that, or I think they're wrong, or I think they missed what I was complaining about. There's no reason why the family doctor can't send you to a second specialist for another opinion, and I think sometimes that's a very healthy thing to do, especially if it's something very serious, if big decisions need to be made, surgery, that sort of thing. So there's no limit on how many opinions you can get for a particular problem. Now, if you want a second opinion about a problem that you've seen the family doctor about, well, you can ask the family doctor to refer you to a specialist. The family doctor has said, I'm assuming you don't need to see a specialist, but you can ask. That's sort of up to the family doctor to decide whether they decide to send you to the specialist for an opinion. Other than that, like it says on the slide, you can choose to go to a walk-in clinic to see another family doctor, or you can try and find a different family doctor.
まあそのかかりつけの先生と話しないともうちょっとわからないし、その先生によって多分どういう対応するのかっていうのも違ってくるのかなと思うんですけども、ただそうやってセカンドオピニオンを欲しいということを言うのは何にも問題はないし、それで気を悪くするような先生は多分ないだろうと思うんですけど、ただやっぱりその個人個人の事情がみんな違うからね、一括して言うことはできませんけども、これは全然セカンドオピニオンが欲しいっていうこと自体は何も不思議なことじゃないし、それは普通にファミリードクターに聞かれて構わないことであると思います。How can they switch or change?
Same way as you got the family doctor in the first place. You don't need a referral. You don't need anything to get a new family doctor. Again, the same way you can find one through a friend. You can go online to find which doctors are taking new patients. There is a system that a lot of family doctors are using now where they sign up a roster of patients called a family health team or family health organization. So they will sign you up and say, okay, you are in my list of patients and I will look after you. However, there's no obligation for the patient. In other words, you can, even if you signed up, the next day you could say, you know what, I don't really think I like my family doctor, or I don't like what they had to say, and you can go to somebody else and sign up to their roster, and you get taken off automatically from the previous family doctor's roster. So again, this is totally up to you, and how you find a family doctor is the same way as you found your original family doctor.
まあだからそれは患者さんの自由で変えたいときはもう新しい先生につけて移ればいいと、そういうことですよね。何か資料をのそのトランスファーというかあれが必要であればドクター同士で話し合ってもらえばいいので、それはもう何の問題もない。いいですか？
So as I mentioned before, to see a specialist, you need to have a referral from a family doctor. You can't, except if it's a specialist that's not covered by OHIP. In other words, you want to have cosmetic surgery, you don't need a referral. You can just call up a plastic surgeon and they will make you an appointment. But for any specialist care that's covered by OHIP, you need a referral from a family doctor. Now, depending on the type of problem, the type of specialist, and the urgency of the situation, that appointment could be tomorrow or it could be 3 or 4 months from now. So the family doctor has the ability, though, if it's a serious problem, to pick up the phone, call the specialist, discuss the case, and say, look, this patient has this particular problem. Can you please see them a lot sooner? So urgent problems get taken care of more urgently, and that's up to the family doctor to arrange that. But I will say that for some non-urgent problems, there can be a significant wait in certain specialties to get treatment.
まあだからもう一番大事なことは家庭医の先生からの紹介がないと見てもらえないということですね。何かこのことで質問ありませんか？Can they specify?
Yeah, so I get patients all the time who say, you know, yes, we need a referral for a particular problem, and a friend of mine has seen this specialist. She was very happy with the care they got at this specialist. Could you send me to this particular specialist? There's no limitation on which specialist you get sent to. It doesn't have to do with geography. I could send you to a specialist in Peterborough if you want, or anywhere else. If you have somebody in mind, I can send you there. I should mention that sometimes patients come in and they ask to see a certain specialist, and it's not always appropriate. For example, for orthopedic specialists, some orthopedic specialists only do backs, or only do shoulders, or only do knees. And sometimes the patient doesn't understand that. They think an orthopedic specialist is an orthopedic specialist, and their neighbor saw this guy, and so please send me to him. So within reason, you could see any specialist you want, as long as they deal with your particular problem.
まあだから答えは可能であるということですね。もしそういう先生がいるなら可能。Is there any way to shorten the waiting time?
So again, it's a very common problem. Sometimes we could try different specialists in the same field to see if their waiting lists are shorter. And again, if it's an urgent problem, it's a problem that medically is necessary to be seen sooner, family doctor should pick up the phone and call that specialist.
まあこれもそれぞれの事情によって違うと思うんだけども、その予約を早めたい理由によると思うんですよね。その医学的に見て当然そうしないといけない理由がある場合と、何か社会的な理由かもしれない場合と対応が全然違うんで、やっぱりファミリードクターに再度掛け合うというよりも専門医と直接連絡を取って相談するのがいいと思いますね。これはまあさっきのセカンドオピニオンと同じようなことになると思うんだけども、So family doctors say there's no need.
So it's up to negotiation. I mean, part of the job of the family doctor is to sort of be a gatekeeper for the healthcare system. So look, I've got patients sometimes who say, look, I really need to see a specialist, and if they don't need to, I try and explain why, and I try to tell them why. But if they're insistent, I'll say, okay, look, I will make the referral. Usually in those cases, the specialists themselves will say either, no, this does not need to see me, or yes, I can give you an appointment, but it may be 6 months from now.
まあさっきのセカンドオピニオンのことと同じようなことになりますけども、だからまあこれはその
Again, not talking about a second opinion. We're talking about a referral that's not really
right,
necessary.
a similar kind of
Yeah.
framework. 患者さんとお医者さんの関係によるんでね、それはもうちょっと一概には言えないんだけども、まあ、こういうふうに紹介をお願いしても良いでしょうかという質問であれば答えはいいですという答えになると思うんですよね。それは何も構わない。
So visit to the emergency department. So if there's a problem that you have that seems to be something more urgent that you don't think would be best looked after by a family doctor or a walk-in clinic, by all means go to the emergency department. Certainly for things like chest pains and bad lacerations and traumatic sort of things, obviously the emergency department is the place to go. The website there will tell you the nearest emergency department in your area. If it's so serious that you need an ambulance, you can call 911. And then depending on the problem, they will say either a regular ambulance or an ambulance with paramedics. In terms of costs, on a previous slide we had, usually for an ambulance there's a nominal charge. It's like $45 to get to the emergency department with an ambulance. However, if you call an ambulance for a trivial problem that really doesn't need an ambulance, you will be charged something in the neighborhood of $200 to $300 for the use of that ambulance.
救急が行かれたことはある方いらっしゃいますか？エマージェンシー行ったことない？ある？待たされました？問題にもよるとは思う。要するにトリアージする人がいてね、トリアージっていうのは病状の重さによって待たされるグループの人をすぐ見てもらえるグループの人に分ける担当のナースなり何なりがいて、とにかく仕分けをしてそれで動いてるのが救急部なので、医学的に特にあんまり重症でない場合には待たされる可能性がある。で、結局見てもらえないで帰っちゃう人もいるのが、現実ですけどね。それは患者さん飲んでどうすることもできないので、それは問題の重症度によるわけです。救急車のことは今お話がありました。で、伝える情報は症状だけ言えばいいと。OHIPがどうの、ハードがどうの、そんなことはどうでもいいんで、胸が痛いなら胸が痛いで、それだけでいいわけです。住所を言わない。
So all the services in the emergency department are covered by OHIP. Why not always go to the emergency department? Well, because you're going to end up waiting a long time. How long you wait at the emergency department can depend on a bunch of things. First of all, obviously the seriousness of the problem. If you go to the emergency department and are having chest pain, you're seen right away because obviously time is of the essence there. If you go to the emergency department with a cold, you may end up waiting 5-6 hours sometimes. It depends also on the time of the day because obviously emergency departments are busier at certain times of the day, the size of the hospital, which determines how big an emergency department and how many doctors are working in the emergency department at the time. And again, obviously during times of outbreaks like flu season where the emergency departments have a lot more people coming in, that will mean you wait a lot longer.
これは一般的なことでよくお分かりになりますよね。何か質問ありませんか？
There is a center where it's sort of halfway between a walk-in clinic and an emergency department called an urgent care center, where they can offer more than they can give you at a walk-in clinic. In other words, they're better able to handle things like lacerations and more urgent things, but not quite. They won't be able to handle heart attacks and strokes. There are a few of them, not many, there are a few of them around Ontario. On this slide it says North York, but the one in North York was recently closed. Oh. Yeah. But so you can look online, they'll give you a list of them. And sometimes they're busier than the emergency department, sometimes they're not. So it's basically, you can take a chance going there if you want to save time, if it's not quite a serious problem that you need to see go to the emergency department.
ER とウォーキングクリニックのちょうど中間みたいなもので、アージェントケアセンターってここを調べれば、インターネットで調べるとどこが空いてるかっていうのが出てくると思いますけど、このスライドはノーセオって書いてあるけども閉じちゃったっていうんでね、消しといてください。Dentist.
So as mentioned before, dental care is not covered by OHIP unless it's done as an emergency in the hospital. Dental care is usually a separate insurance plan given by some companies to have your dental care covered. But again, you either pay for it through private insurance or your business that you work for covers it. Otherwise, everybody else pays for dental care. To find a dentist, same thing. You can ask a friend. The Ontario Dental Association has a program to find dentists. In general, it's pretty easy. In other words, dentists don't usually put a limit on their practices, and they're more than happy to see you. And usually the appointments, you don't have to wait that long.
まあだから日本で考える歯科治療っていうのはとにかく公的保険は効かないということです。自分の保険がないとカバーできる。その歯科治療のフィースケジュールっていうか、その値段のあれが日本と比べて、日本はどこだったんですか。公的保険の人でした。全額。リミットがある、上限があるんでしたか、払う。そうです。ただそれが日本とね、ここで同じ治療で同じような値段かどうかってよくわかんないんだけども、プライベートの保険がないとかなりの出費になると思いますから、はい、ぜひ入ってた方がいいと思います。
As we talked about before, the optometrist, you can self-refer. Same thing, you can call and book your own appointment. You don't need a referral. Usually there is a charge for seeing an optometrist because it's not covered by OHIP unless you're over 65, in which case you're entitled to one visit a year. Even if you're paying for it, even if you're under 65, if you're going to the optometrist for a regular eye exam, they will only do that once every 2 years.
お分かりになりましたね。さっきも話が出ましたけども、よろしいですか。
No need for referral for any of those 3 appointments. You can just call and self-refer.
まあだから全然紹介状はいらないんで、直接連絡を取っていくですね。
So, for pregnancy, pregnancies can be handled by 3 different routes, actually 4 different routes. Some family doctors do prenatal care and deliveries. Some family doctors just do prenatal care and send you to the obstetrician in the last several weeks to do the delivery. You can see an obstetrician all the way through for prenatal care and delivery, and midwives. You can also see for prenatal care and delivery. You need a referral if you're going to see an obstetrician, but other than that, like I said, a lot of family doctors deal with that.
そう、ファミリードクターの中にもその産科をなんていうか専門って言い方はおかしいんだけども、中心にやってる方もいらっしゃるんで、そういう方も担当できるし、助産師の方もできると。助産師っていうのは、
No, it's not nurse. They're trained specifically in the midwives program. They usually work in conjunction with obstetrician. In other words, if there's a problem, they go back up.
そのオンタリオの助産師さんっていうのは、日本だと看護師さんで助産師の資格っていう格好になると思うんだけども、必ずしもそうじゃなくて、それ自体でこう独立したなんかトレーニングのメカニズムを持ってるんでね、日本とちょっと違いますから。ただ彼女たち、彼らが働いてるののそのなんていうんですか、その環境っていうのは必ずその産婦人科医あるいは病院とのバックアップの体制になってるんでね、扱うその、事象の性質上そういうことにならざるを得ないけれども、そういうことです。だから看護師さんではないんですけどね。よろしいですか。
すみません、ここのちょっと一つ前のことで質問があるんですけども、スポーツドクターって何を見るお医者さんなんですか。
Can you explain what sports doctor is?
So, a sports medicine doctor usually is a family doctor who has extra training or extra interest in injuries that happen through sports. So they may have a little bit more training for dealing with, sprained knees or just any sort of injury that happens through sports. Most family doctors, that's what we do anyways. But some people have extra training and maybe they will be associated with a physiotherapy department, and so they can refer to a physiotherapist they're associated with. But it's generally sports-related injuries or training injuries.
スポーツドクターの分は OHIP でカバーされるってことなんですね。
It's all covered.
Yes. But not the
怪我
physiotherapy
怪
part.
我だからね。
怪我
フィジオセラピーはカバーされないから、同じクリニックの中にあったとしてもカバーされないコンポーネントが出てくるかもしれないですよね。ただスポーツメディスンっていうのはなんか問題があっていくわけだから、膝が腫れてるとかなんだかわかんないけど、それは医学的な問題なんでこう言ってカバーされる。So,
I'll make an appointment.
so well, health checkup.
Yeah, so again, this is a little bit actually controversial, whether a regular health checkup is necessary or not. There's not a lot of medical, scientific proof that it makes a huge difference. Certainly, we're happy to offer it, and again, I do lots of checkups every day. Simply call the family doctor's office and they can arrange a checkup. Gynecological examinations, things have changed with that a little bit too. It used to be that we would be recommending pap smears once a year for women. It's now been recognized that that is probably too frequent and not backed up by any sort of medical necessity. So now, generally, pap smears and gynecological exams, unless there's a problem, is usually once every 3 years.
まあだからその人間ドックっていう定義にもよるんだろうと思うんだけど、日本でやってる人間ドック、もちろん自分でお金払ってやるわけだけど、それに値するようなものはこっちではさっきのプライベートクリニックのようなものがあると。だから家庭医の方でOHIPのところへ行ってOHIPでカバーされる範囲で検診を受けるとなると、多分その検診の内容っていうのは日本とだいぶ違うだろうと思うんですよね。でそれは理由があって日本が良くていや日本が悪くてカナダがいいとかそういう意味じゃないんだけども、どっちかっていうとやっぱりカナダの医療っていうのはその日本で今もエビデンスって言ってると思うんですけども、医学的な証拠がはっきりしているものに税金を使って、国民州民に受けてもらうっていう考え方になってるもんだから、エビデンスがないものに税金を無駄遣いしたくないっていう意味が裏返せばあるわけで、そういうわけで何の症状もないのに例えばね MRI を受けるのを税金でカバーするなんてことはしないわけですよね。でなぜ医学的な証拠がないかって、例えば何か頭の中見つかってもね、手術するべきなのかどうかっていう判断が非常につかないようなものが見つかる場合が多いのと、見つかったらやっぱり心の負担にもなるだろうし、手術して余計具合になるかもしれないだろうし、そういう証拠がはっきりしない検査がたくさんあるものですから、家庭医のところへ行かれたら多分非常に検査する項目のリストっていうのは日本に少ないんだろうと思います。
I should mention that in Ontario, in general, gynecologists will not do routine gynecological examinations for screening. In other words, they will only see problems. So it's a family doctor that does the
婦
routine
人科の
gynecological
疾
care.
患で言えば、その子宮頸がんの早期発見のためのスメアっていうか、その子宮口のところからこうちょっと細胞を取って調べるのがあるんだけども、まあ、今までは1年1回っていうことになってたんだけども、あんまりそんなことしても意味がないということで、大体3年に一遍になる。で、カナダの場合は家庭医がそれをするんであって、産婦人科医の先生はそれは一般の検診の、枠組みの中ではやらない、家庭医でやってもらうということです。パップスメアって言ってるんですよね。質問ありませんか？じゃあ、またすみません。
先ほどファミリードクターのところで定期検診をされるって言われてたと思うんですけれど、じゃあ今回のこの話を聞くとどのぐらい定期検診で見てもらえるのか
多分ね、はっきりした基準はないと思うんですけど、is there any particular guideline how often the health checkup should be done for like person like her?
So we have guidelines for particular parts of the health exam. Pap smears we know once every 3 years. Mammograms in general every 2 years most of the time in women over 50. But like I said, a lot of what we do on a regular checkup up until now has not been evidence-based. It's not based on any sort of studies. So some people like to come in once a year, and that's fine. There's no reason, at least in my practice, I say if you want to come once a year, be my guest. Some people say every 2 years. Again, it depends if you have other medical problems.
But there's a OHIP limit.
So yes and no. You're not allowed to bill a general checkup for the same diagnosis more than once a year.
Okay.
So minimum or maximum, minimum once a year. So in other words, if you want to come in once a year for the same diagnosis, no problem. But if you have a new problem and you want to, and we need to do a complete general assessment at 6 months after the last one, that's also permissible.
ちょっとやっぱり人によると、患者さんによると思うんだけども、何にも問題がなくてね、何の家族にも何にも心配ないんだったら、まあそうですね、50より若ければ、僕だったらまあ2、3年でいいかなと思う。
その時は自分で健康診断とか定期検診をしたいんですファミリードクターにお願いするんです。
ヘルスチェックアップしたい。でその場で行った時に、まあ前にすでに情報は入ってるかもしれないけど、家族歴とかね、自分の起用歴とか説明することになると思うんです。だから人によると思うんだよね。はい。
まだファミリードクターを持っていないので様子がよくわからないんですけど、最初にファミリードクターを持つときにその一般的なそのチェックアップだとかインタビューだとかどういったことがなされるのかなされないのかそこを教えていただきたいんですけど。
So she doesn't have a family doctor yet. So when she first sees the family doctor, what kind of things will happen?
So that depends a lot on the family doctor. Some family doctors do something called a meet and greet, basically where they just introduce themselves. You tell them a little bit about your history, your medical problems that you've had in the past. They tell you how they run their practice, a lot of the things we've talked about here, what their philosophies are. And then you can see if you're happy with them and they're happy with you, you can book an appointment for a checkup at that point. Usually the first visit you don't do a full checkup. Sometimes the first visit is because you have an acute problem that you want to take care of. In my office, we book appointments mostly to do that sort of meet and greet thing, and usually also to arrange getting a copy of some previous records if there are any. But it depends really on what the family doctor, how they run their practice. If there's no problem going on and it's just trying to get a new family doctor, then that's usually what happens, just to discuss and see if you guys match and are a good fit.
まあだからやっぱり状況は人によって違うとは思うんだけどね、まあお見合いの最初みたいなもんですよね。顔合わせですね、最初に。それでいいとなったら次に行くっていう感じになるかなと思いますけど。Allergy diagnosis and treatment.
So there are allergists who are specialists who need a referral. Primarily, family doctors send patients to allergists if they need allergy testing or if they're having symptoms that we're not sure are coming from allergies. For example, food allergies would be something we'd send to allergists, or if we're planning or thinking of getting injections for allergies. However, most allergy problems, if the family doctor can make the diagnosis of an allergy, and most allergy problems, it doesn't even really matter what you're allergic to because you're going to be treating it the same way. For most patients in my practice, it doesn't really matter whether they're allergic to maple trees or to grass. You can't avoid these things, so it doesn't do you any good to know that you're allergic to one or the other. So we treat the allergies. Now, if we're unsuccessful, if by the treatment of the allergies you're still not better, or we can't figure out what's going on, or we think something else is going on, then you can send to an allergist. But for most allergy problems, family doctors should be able to handle it.
ファミリードクターが対応できるのがほとんどなんだけども、もし何か医学的な理由でね、どうしても何が アレルギーの原因かっていうのをはっきりさせないといけないっていうことになれば、ファミリードクターがアレルギーの専門家に紹介してもらって、そこでテストを受けるっていうことにはなると思うんだけども、いずれにしても治療はほとんど同じなので、そこまでいかなくても、一般的には多分家庭医の方々が処方して治療していくのがほとんどだと思います。ですか
Right. So some family doctors do have extra training in dietary stuff and food-related problems. Some family doctors have dietitians associated with their practice. However, there is I don't know what I did with it, but there is oh, here it is, here. So there is something called Eat Right Ontario. Something Eat Right Ontario.
Eat Right Ontario.
And there's a phone number or a website where you can call and get dietary advice for free. There are also dietitians that make their living off advising people and they charge. That's not covered by OHIP. But Eat Right Ontario, like I said, and it's basically www.eatrightontario.ca, and you can call them or go on the website and they can give you information.
It's free.
Free.
Eat Right Ontario っていうところです。あと栄養士さんの指導は OHIP でカバーされないんで、その栄養士さんのフィースケジュールによってチャージされると思います。他にもいろんな健康指導があるとは思うんですけども、何か特別こういうことはっていうような質問ありますか？はい、全然休憩取ってないけど最後まで言っちゃって後で質問を受け付けた方がいいかなと思うんですけど、どうしても休憩がっていうことになれば休みますか？どうします？どうですか？休憩した方がいい？あ、いいですか？いいですか？じゃあこのまま、これはアレルギーの非常に重症な発作が起きたときどうするかということですけど、アレルギー何か例えばピーナッツとかアレルギーとか持ってらっしゃる方いらっしゃいます？じゃあ簡単に How to deal with allergy.
So this is talking specifically about anaphylaxis. So by definition, if somebody's having an anaphylactic reaction, that's probably a medical emergency. If it's a question of just getting hives and a rash, then sure, go to the family doctor, take a taxi, drive yourself. But if we're talking about issues related to swallowing or breathing, where it's a true anaphylactic reaction, basically you should get to the hospital as soon as possible, usually by ambulance. If this is a known allergy, you should be, and that's prone to anaphylaxis, you should be carrying something like an EpiPen. And remember, an EpiPen, which is a treatment for anaphylaxis, is not a full treatment. It's something that allows you to get to the hospital on time. So anybody who uses an EpiPen should make their way to the hospital, usually by ambulance, because it's a medical emergency.
ジンマシンが出て赤くなってっていうのはそれだけだったらねほとんど問題ないんだけども、そのジンマシンで皮膚がバーッと膨れてくるのが例えば喉にこうやって起きると息ができなくなるとかね、それから全身に広がるとその血圧が下がって気を失うとかね、気持ち悪くなるとか、だからそういうことになったら緊急疾患なんで救急車を呼ぶと。自分が何にアレルギーそういうことを起こすかって分かってる人ももちろんいるんで、そういう人は注射器を持っててね、それをすぐ打つんだけども、初めてだったら分かんないから、だからその呼吸がどうなるかっていうのが、呼吸ができてるのかできてないのかっていうのが一番の見分け方かなと思いますけどね。ただのジンマシンは救急車なんか呼ぶ必要ないですけど。ファミリードクター制度一般に関して、次は薬ですけど、最後薬と予防接種のことですけども、何かありますか？じゃあ薬。So that was explained many
Yeah,
times.
but the question about the same pharmacy,
Yeah.
Yeah. So it's always a good idea to use one pharmacy for a bunch of reasons. First of all, if we're talking about any drugs that are controlled substances like benzodiazepines and narcotics, it's actually against the law to be getting narcotics from two separate pharmacies. That's number one. Number two, the pharmacist will have a record of your previous drugs that you're using to be able to tell if the doctor's prescribing a new drug and has forgotten the other drugs you're on. The pharmacist may be able to alert the doctor that you shouldn't be giving this drug because they're already taking this other drug. And it's just probably a better idea. There's no rules, but it's a better idea to use one pharmacy where they have your medical record.
だから薬局薬もらうところは when you say same premises, you don't mean like Shoppers Drug Mart.
No, no, no. The
Same location,
same
same
location,
store.
yeah.
だからショッパーズドラッグマートの例えば行ってね、どこでも記録が共有されてるかというと、まあそういうチェーン店もあるかもしれないけど、まずそういうことはないんで、同じロケーションのそこへ行って記録が残っているところでもらうのがいいだろうというのは、そのドクターがその薬ナンバー1とナンバー2とナンバー3とあって、どれ処方されてるか忘れちゃったりしたことがあるんで、組み合わせがまずいことがあったりするのは、ファーマシストはその記録を見れば分かるということですね。あとは日本で睡眠薬として使うベンゾダイアゼピンって言いますけど、それとか他に法律的規制されてる薬があるんですけど、モルフィンだとか麻薬の類だとかね、一応その別々のところでそういうものをもらうっていうことはダメなことになってるんで、そういう意味からも必ず特定の薬局で全てもらうっていうことにした方がいいだろうと、そういうことです。いいですか。
I mean, so non-prescription drugs, obviously it's worthwhile to have anti-allergy medications at home, depending on what it is you're allergic to, like common over-the-counter anti-allergy drugs. I don't think, you know, you used to say to have some Ipecac at home, but right, that used to be what they say.
We don't say it anymore.
I know they stopped several years ago, but other drugs probably. I don't think there's any other drugs that you should have at home all the time.
市販薬っていうのは要するに処方なしで買える薬ということですから、ということ